Good evening and welcome to the webinar. My name is Jennifer Scanlon. I'm a field marketing specialist with Axonics Therapy, and I'll be your moderator this evening. Just a couple of quick notes before we get started. Your video and audio have been disabled, so we cannot see or hear you. If you have any questions during the webinar, please feel free to type them in the Q&A feature located on your screen. We will direct the questions to our speaker at the end of the presentation. Please note, all questions will remain anonymous, and we are only able to answer general questions and are not able to utilize this setting to diagnose your condition. During the webinar, you will see important safety information about the products, and as with any medical procedure, there are some risks. You can visit axonics.com for additional safety information, and of course, bring all important questions to your healthcare provider appointment. This evening, we are so excited to welcome Dr. Keith Xavier with Urology Partners of North Texas, who will be speaking about bladder dysfunction, the common symptoms patients experience, and treatment options that may help you regain control. So without further ado, I would like to introduce Dr. Keith Xavier.
All right, thank you very much for that introduction, Jennifer, and thank you to Axonics for helping us set up this program. It's been a little while since I've done this, so thank you to everyone that's logged in, listening to it. Thank you for taking the time out of your busy schedule this evening. Hopefully, you get some good information from this, and this is helpful. That's the whole part of this is just education, and we're going to be talking about bladder and bowel health today. And like Jennifer said at the end, there'll be time for questions and answers. But hopefully, once again, this is helpful, and this is sort of an education seminar. So with that being said, I will go ahead and get started with the slide deck. It shouldn't take too long, but we'll go through it. And this is one of the disclaimers that Jennifer mentioned, just regarding Bulkamid, which is a treatment for stress urinary incontinence that we'll talk about. You can get more information on the Axonics website regarding this. And here's some more important safety information. So we're going to go through this. Okay, a little bit about me. I've been with this group for 16 years, believe it or not. We've had a couple of different names, but Urology Partners of North Texas, there's over 30 of us, so it's one of the larger groups around. We have offices all over our biggest offices are in Arlington, Fort Worth, and Irving, but we have offices in Bedford, and so we're sort of all over the Metroplex, mostly Tarrant County. And I've been with the group for 16 years, focused mostly on bladder health, bladder incontinence, pelvic floor issues, although I do a fair amount of general urology, kidney stones, a lot of prostate type things. But the good thing about our group is, with being such a big group, we can sort of specialize and sort of focus where we want. And my main focus is on pelvic floor disorders in men and women and incontinence disorders. So that's just a little bio about me, but I've been here locally in the Metroplex since 2008. All right. Okay. We'll get on with it then. Bladder symptoms can disrupt your life, as many of you know, and as a lot of my patients over the years who come to see me for having to constantly stop on trips, having to leave movie theaters so they go to the restroom, or worried about, when they go to a mall, mapping out all the bathrooms, worried about leaving their house, just really worried about, both their urinary and bowel issues. So it's a problem that affects tens of millions of Americans. So if you have this, you are not the only one. As this slide points out, this condition is just not a normal part of aging, although that is definitely associated with it. It's not just being it's not just being a woman, and men also get this. It's not just a prostate issue all the time, and it's not necessarily caused by something that you did. So I think those are important pieces of information to know that it's not just something that's there and that you have to deal with it and that you can't do anything about. Your condition, whether it's your bladder, whether it's frequency, leakage, and your bowel issues, it can cause physical limitations on your life and your quality of life, social limitations. As I mentioned, some people, they don't want to go to restaurants, they don't want to go to friends or family's houses, they don't want to leave the house, they don't want to go to the mall, they don't want to go shopping. And that's due to fear of accidents or worried about what could happen. And there's even things such as sexual issues, intimacy issues, not wanting to do that because of problems with your bladder or your bowels. Work issues, absence from work, decreased productivity. And then there's the domestic issues such as wearing pads or diapers or taking precautions with clothes. No, not to mention, that's not on here, the financial impact of things such as that, especially pads, diapers, some of you out there that have those. I hear it every day, patients who come see me and they say how expensive it is to have to wear these. And a lot of times, to my knowledge, insurance companies, Medicare, things like that, they don't cover pads or diapers. So you are not alone. Definitely not alone. As this slide mentions, 30 million, 30 million plus folks suffer from this, okay? And this is just stress incontinence. Stress incontinence is leakage with physical activity. So laughing, coughing, sneezing, jumping, running, lifting, exercising, bending over, jumping on a trampoline, playing tennis, and you have leakage. Okay, that's stress incontinence. So over 30 million women in the United States, which is a lot, suffer from this. So let's talk a little bit more about stress incontinence. That's one of the most common disorders that I treat, that our group urology partners treat, that people more and more, thankfully, are seeking attention for now that they know that there are good treatment options and that people don't have to live with it. So stress urinary incontinence, mentioned, very common condition, affects 1 in 3 women at some point in their lives. It's typically due to having children. Uh, there is an aging process, weakening of the pelvic floor muscles. What is stress urinary incontinence? Once again, it's leakage with physical activity, coughing, laughing, sneezing, due to an increase in intra-abdominal pressure and a weak urinary sphincter that will cause someone to leak, whether it's drops or flood, whether it's a liner or diapers. Stress urinary incontinence definitely affects lives. If you've had previous bladder surgery, hysterectomy, things like that can play a role in this also. But it tends to, I see women in their 20s and older who get this, and it does interfere with their quality of life. So the good news, stress urinary incontinence, is there are treatments for women that can help. There's also treatment for men who get this, but I think the focus of this will be on women. What are the treatment options for stress urinary incontinence? Okay, there's basically 3 options. Okay, and this slide really sums it up well. The most conservative treatment option are pelvic floor exercises or Kegel exercises. A lot of you out there have done these or are currently doing them and know about them, and your doctors or providers along the way have told you to do these. And those are once again pelvic floor Kegel exercises that can strengthen the muscles, can on occasion lead to improvement in stress urinary incontinence. The other 2 options are more minor procedural options, urethral bulking, which we'll talk about, and then there's also surgical procedure called a sling that we've done for a very long time to treat this. Stress urinary incontinence management. Okay, there are some lifestyle changes that can help. Okay, sometimes maintaining a normal weight or losing weight can help. Okay, I see this every day. Just this is stress urinary incontinence is just not, it's not caused by being overweight or being more overweight than your normal estimated body weight. That can play a role, that can potentially lead to worsening leakage, but that is not, the sole cause of this. That being said, sometimes losing weight, if it is playing a role or worsening things, can help. So keep that in mind. But also just losing weight or getting on medication for weight loss, things like that, that's not going to miraculously solve your stress incontinence. Unfortunately, it doesn't work like that. Stopping smoking and anything to control a chronic cough can help. As we mentioned before, a cough is, coughing when you're sick, when you have the flu. That is a big reason that women leak with stress incontinence. And pelvic floor exercises, as I mentioned, the Kegel exercises, 95% of women do that on their own. You can also go see a physical therapist. We can send you to a physical therapist who specializes in this if you want to work with someone one-on-one, to kind of get further training and make sure you're doing them right. These are things that can help, but the vast majority of people can do these at home. You can do them while you're watching TV, while you're at a stoplight, whenever you think about it. And once again, they can help. Sometimes they do, sometimes they don't. Sometimes they improve things, sometimes they don't, but they're probably not going to hurt you, and they're worth trying as the most conservative type of treatment. Okay, let's talk about the surgical sling that I mentioned earlier. The goal is to support the urethra. This has been out 25 years, 80 to 90% success rate. We have and continue to do quite a few of these in the right patient, although I would say its use is decreasing a little bit over the years, since there are some potentially less invasive options. Still considered to be the gold standard by many from a surgical treatment of stress incontinence. Women who plan to have more children, they may want to wait on this procedure until they're done having children. That view just gives kind of a brief view of how a sling works. We place a little sling or hammock underneath the urethra to hopefully get rid of leakage when women laugh or cough or sneeze or exercise. Okay, urethral bulking. I don't want to say that's a newer treatment, but there have been improvements in the type of urethral bulking agents out there, which have made a big difference the last 2 or 3 years, that have been out, since they've been out. So there's something out there called Bulkamid, which is, I think it's safe to say a lot of folks who do what I do think it's probably the best type of bulking agent out there. And this is injected into the urethra with a small scope. Typically, we knock patients out for this or put them under light sedation. It takes about 5 minutes. And it's done as an outpatient setting where you go home the same day. And once again, we inject, if you could look at the picture there, we inject the bulking agent into the urethra to kind of, in a way, close it off, but it should not keep you from urinating, but can definitely improve or prevent you from leaking, when you cough or laugh or sneeze or jump or run. Here's a little bit more about Bulkamid. This is Kathy. She's a real Bulkamid patient here. Okay. What is Bulkamid? Bulkamid is a minimally invasive non-mesh alternative to treat stress urinary incontinence. It's a soft water-based gel. It's actually been out for many, many, many years, was done in Europe and still done in Europe before it came to the United States about 3 or 4 years ago. And it's really caught on here and given us a very nice alternative option to slings, for women who want their stress urinary incontinence treated. Okay, how does Bulkamid work? Let me see here. I think there's a video. You know what? Okay, let me hit this here.
Bulkamid
Okay.
can help provide the relief you've been longing for. The short, incision-free procedure typically takes less than 10 minutes. Involves 3 to 4 small injections of soft, water-based gel into the wall of the urethra to help prevent urine from leaking out of the bladder during day-to-day activities. It's safe, quick, and most patients can get back to your normal activities almost immediately.
Okay. So it's a nice little illustration here. Let's see if I can get back to, okay. Yeah. Okay, here we go. So once again, that was a quick illustration of Bulkamid, very quick outpatient. Yeah, honestly, it's about 5 minutes. Patients are in and out, and as the slide or as the video mentioned, patients are basically back to normal right afterwards. There's no cutting or anything like that. It's kind of like a facial filler, but it's in the urethra to help with leakage. I've never seen anyone have a bad reaction um, to to the Bulkamid. Okay, so it's very safe. It's a hydrogel like material. Once again, uh, hundreds of thousands of cases of this have been done worldwide over the past many years. What else do you need to know about Bulkamid? Safe and effective, as I mentioned, it's very safe. It's a nice thing about it. Simple procedure, and studies have shown that it provides long-lasting relief, okay, out to 7 years. Occasionally, patients may need a second procedure, what we like to call a touch-up. If they've seen significant improvement, maybe not 100%, you always go back in and do it again or do a spot or two that could get someone totally dry. So it's nice. It doesn't burn bridges. You can still get a sling with it in the future if you need to. So that's nice. And then here's just some more safety information. You can find out more about this at the Axonics website. And this is talking about sacral neuromodulation therapy for overactive bladder and fecal incontinence, which we're going to get to next. So hopefully, once again, if you have questions, save them, write them down. We happy to answer those at the end. Here's some more safety information. Okay, you are not alone. So this is Jill. She is a real life Axonics patient. And let's see here. So, okay. Okay, we're gonna switch course a little bit. We talked about stress incontinence, which is very common. Now I'm going to talk about something that's even more common than stress incontinence, believe it or not, that probably a lot of you out there who are tuning in have, and that's overactive bladder. And it affects 50 million people in the United States. So 50 million men and women. And fecal incontinence or bowel accidents, as we like to say it, that affects another 20 million people. So we're going to concentrate on that currently. Okay. Overactive bladder may be caused by some of the following. So overactive bladder, let me first go over this. That's basically a sudden urge to urinate, possibly being unable to hold or control it to where you may have an accident. So it's basically when you gotta go, and there better be a toilet right next to you. Otherwise, it's coming out, or it's coming out when you're opening up the bathroom door, or when you're pulling down your pants, or when you see running water, or maybe you go sitting to standing and it's, oh, I better get there. That's overactive bladder. So frequency, urgency, a lot of people leak because they can't get there, and then waking up at night. That's part of overactive bladder. Urinary retention is actually where you have difficulty urinating and you don't empty your bladder. And then, as we mentioned, fecal incontinence, also known as bowel incontinence or bowel accidents or bowel leakage, that's the same as overactive bladder, but instead of having urine accidents, you have accidents with your bowels, right? Which is even potentially more devastating for people in terms of quality of life, leaving the house, functions, stores, restaurants, malls, things like that. If people are worried about that and worried about finding bathrooms, it can really hamper your quality of life. And we do see that a lot. Once again, there are good treatments, thankfully, that I think more and more people are learning about through their providers and through, seminars, education sessions like this. Okay, this is just briefly normal bladder function. What's the bladder is there to store urine. Okay, bladder relaxes, your urethra contracts to hold it in. And then when you get full and you want to go, the bladder contracts, the urethra relaxes, and you urinate. Okay, so that's just kind of a very basic diagram. Okay. What is overactive bladder? Once again, we talked about this. Frequent or urgent need to urinate to empty the bladder. It often, I apologize, it's my dog. Overactive bladder often results in unintentional urine loss. Okay, as we mentioned, frequency, urgency, urgent continence. And once again, urgent continence is when you gotta go and you can't get there on time and it's coming out before you're ready for it to come out. And then nocturia, which is if you get up 2 times or more at night, believe it or not, that's not normal. That's considered abnormal. Once or more, I'm sorry, once or less at night is normal to wake up to urinate. If you're waking up twice or more at night, that's not normal, okay? And we want to get you down to 1 or 0, and there are ways to do that. Fecal incontinence is the uncontrolled loss of stool. It could be solid, liquid, and the symptoms include urge incontinence or passive incontinence and soiling. So same thing as with the bladder. It's pretty similar. With the bowels, you can have fecal urgency where it's a sudden urge. You better find a bathroom, or the inability to stop the urge and you actually have to go and pass your stool. And then passive fecal incontinence, which is leakage of your bowel stool with activity or without awareness. It can happen and you don't know it, and that's the worst. Normal bowel function, once again, this is, the rectum fills, stretches receptors, nerve signals are sent to your brain, which will make you feel like you need to empty your bowels. And then when you defecate, the nerve signals coordinate the relaxation of your pelvic floor, and you push out your bowel contents. Okay, so that's normal bowel function. Good news, as I mentioned, there are treatments to regain control of your bladder and bowel. 70 plus million Americans have this, men and women. Okay. Stop. Okay. Sorry about that. All right. Patient care pathway. Okay. So let's talk about how we can help you with your bladder or your bowels, or, I see a lot of patients who actually have both. Okay. These conditions tend to occur together, and, all these things are related next to each other. Nerves, your organs. So a lot of people who have overactive bladder or bladder incontinence also have fecal incontinence. All right. So, let's talk about this. Number one, consult with your doctor, okay, to discuss your symptoms. There are treatments out there. I think back in the day, a lot of people thought, well, I have to live with this. There's nothing out there, or they were too embarrassed to talk about this, okay? Please, if you get anything out of tonight, it's that you don't have to live with this. There are plenty of treatment options out there. Some are new, some have been out there a while, and there's ways to improve your quality of life and to help. You just have to let someone know. Once again, hopefully you get filtered down to us, the urologists, the specialists who kind of do this day in, day out. But it may start with you needing to tell your primary care doctor or scheduling an appointment with your urologist. So that you can discuss this, even if you're not sure if you have what we're discussing today, or if there's things to help you. All right. So let's keep doing this. Okay, did you know that 80% of people with overactive bladder, there are pills for overactive bladder, right? If you're going a lot, rushing, leaking urine, there are some good pills out there, and that's typically what we try first. We don't just go straight to procedures, surgeries, okay? Although I see a lot of people that have done all that other stuff with other doctors, maybe their primary care doctors, maybe other urologists, and when they see me, they want something done, and we'll get on with it. But if you haven't, no problem. There's pills out there, and sometimes the pills work, sometimes they don't. Okay. The good news is if pills don't work, or they don't work well enough, or you don't want to take a pill every day because you're on 10 other pills, or I see this all the time, the pills are too expensive, the insurance doesn't want to cover it, or there's side effects from pills. Okay, that this happens every day to a lot of people. So sometimes pills are not the answer. Nice thing is there's advanced therapies to help you with your bladder. Okay. And to help you with your bowels. Okay. There is something called sacral neuromodulation, which we'll talk about. There's now treatment where, believe it or not, we could stimulate a nerve in your ankle and it works on your bladder and your bowels. And then there's Botox injections. Some of you out there may have heard of this or possibly had it done by me or someone else. These are all aimed at helping folks not go as much to the bathroom, not leak as much urine, things like that. Okay, advanced therapies. These are therapies when conservative treatment, which, cutting down on your fluids, cutting down on your caffeine and soda, trying medication. When those don't work, then we go to advanced therapies, and there's 3 or 4 of these. So this is a brief slide on one of them. This is kind of one of these ankle, as we call tibial nerve procedures, where we could stimulate a nerve in the office that works on your bladder. Okay. However, you have to come in every day, or I'm sorry, once a week for 30 minutes for 12 weeks. It's very time intensive. Yeah, works okay. It's been around a long time, but that's one of the options out there, and we do offer it. Botox, okay. Botox has been around probably 15 years. Like all these other treatments we're going to discuss tonight, should mention these treatments are FDA approved. They're covered by insurances. So is Botox. Botox, you come in and you get an injection in your bladder. You get anywhere between 5 and 20 injections into your bladder, okay? And on average, they need to be done every 6 months. That's one of the main problems I see with Botox. People don't like having to come in every 6 months and definitely to get injected with Botox. However, some people are good candidates. Some people love it. Something we offer. Okay, we do all of this. The nice thing is, we can figure out what's best for you, and we offer it all. So, this may be something you need, but there are some good and bad, I would say, points about Botox. Okay, sacral neuromodulation. I think we have a video here. Here we go. This is basically a bladder pacemaker or a bowel pacemaker, okay, where we stimulate the sacral nerve through a minor procedure with a battery connected to a lead that, by stimulating those nerves that go to your bladder and bowel, can help people not go as much, have more time to get to the toilet, not leak as much, go through less pads, diapers, sleep better through the night. Okay. It is a 2-step process. All right. And you may be asking, well, why is it a 2-step process? This procedure, and we'll get a little bit more in depth with it, we can actually give you a trial unit, a take-home unit, a temporary external unit for you to try for 3 to 4 days at home. So you get a chance to see for yourself if it works, if you like it. And you can test drive it. Okay. There's not many procedures, surgeries out there where you can actually try it first before you buy it, as we like to say. It's one of the really nice things about this type of treatment, sacral neuromodulation. Once again, this is for bladder leakage and bowel leakage. Okay. Through a 5 to 10 minute, very minor, procedure with you awake using a little numbing medicine, we can give you a take-home unit. So you can see for yourself. Once again, if you don't like it, it doesn't work, you haven't lost much. We move on. Only if it works and you like it and you have a great result during those 3 or 4 days, then we do the minor. Typically, it takes me about 30 minutes to do these, where we implant the battery and lead under the skin. We zonk you out. It's a quick in and out day surgery, kind of like getting a colonoscopy. You come in, get it done, get some laughing gas, get it done, wake up, someone drives you home. Okay, so we're going to go more in depth about this. So these are real life patients who have had this procedure, Jill and Melissa. Not sure if there's a video. No, there's not a video. Okay. What is axonics therapy? So sacral neuromodulation, which I have just been talking about. It's a guideline recommended therapy that restores normal control of the bladder and bowel. It could help your bladder, it could help your bowel, it could help both. A lot of my patients have both. And those are the happiest patients, who have both bladder and bowel issues that are markedly improved with this, okay? It could also help urinary retention. So if you're struggling to urinate, to empty your bladder, maybe you need a catheter, or maybe, you're retaining urine, and that can cause issues, urinary tract infections, things like that. This can treat that. This can get your bladder squeezing out more urine, emptying better. No need for a catheter, or less need for a catheter, things like that. So I didn't mention that very much, but That is also one of the reasons that we do this. It's FDA approved for this. It's covered by insurances for this, in addition to the bladder and the bowels. All right, a few more slides here, and then we can get to your questions. How does axonics therapy work for overactive bladder, fecal incontinence, urinary retention? I like to think of it as it's basically an abnormal communication between your brain and your bladder and bowel, okay? So by gently stimulating the nerves, okay, that go from the brain to the bladder and vice versa, this can help restore normal communication between the brain and the bladder and bowel, which can result in an improvement in your symptoms. Once again, going to the toilet less, having more time to make it, less leakage of your bladder, less leakage of your bowel, sleeping better through the night, emptying your bladder better if that's your issue, okay? And this has been out there, sacral neuromodulation has been out there since 1997. A lot of it's been done throughout the world in that time. So this isn't just something that's newly invented that we don't know about. Been out there forever. Safe, effective, works well. Plenty of um, journal articles, research studies done throughout the years with tens, hundreds of thousands of patients, okay? So keep that in mind. So the first step towards long-term therapy, if it's determined that axonics therapy is right for you, once again, we can put you through a brief test period for 3 or 4 days. And that's done pretty easily. It doesn't really interfere with your 3 or 4 days. You can more or less do what you want, and you can try it at home in the comfort of your home, and then you'll come back and in a couple of seconds we'll remove the test unit and you'll tell us how you did. So basically I'll insert a thin wire called a lead near the nerves in the upper part of your backside, okay? Has nothing to do with it's I like to tell people they think it has to do with your spine, things like that. No, it's far away from that. We're not spine doctors, we're not neurosurgeons, we're urologists. This is nowhere near that. The nerves are they're basically we can access them through the top part of your backside on both sides, okay? And it's very safe, nowhere near any kind of vital structures or organs, which is very nice. All right. You track your symptoms at home, see if they improve, and then you come back 3 or 4 days later, discuss with us. Hey, do I like this? Did it help me? And I would say roughly 75 to 80% of the time, people love it and they choose to move on. Okay. And if they move on, there's two options. The stuff's pretty high tech and lots of improvements have been made in the therapy over the past 25 plus years. Okay. If the take-home unit works, it helps your bladder or it helps your bowel or it helps both, and you say, look, I love it, I want to do it. You would have the choice of, I mentioned there's a 30-minute day surgery where we implant the battery and lead under the skin. You're knocked out for it. You can get a rechargeable battery that lasts roughly 20 years, okay, that you have to periodically just charge. What most people do is they get the non-rechargeable device, which usually, which is about I tell people a 15-year battery. You don't have to do a lot with it. Once again, these batteries are very, very high tech. Okay, as we'll talk about in a sec, you can get an MRI with them. They last a long time. Very minimal care is needed with these. Okay, you can come in and see us once a year, twice a year. You could do some mild setting changes at home on your own. We can teach you all that depending on how involved you want to be. Some people don't want to mess with it. That's fine. They just see us once or twice a year. We'll mess with it. Some people, they don't come in anymore once they get it. They just take care of it on their own. It doesn't matter to us as long as you're doing well and happy with the therapy, and yeah, that's all we care about. But we're here to not only just put in the device, but to follow it with you because it's a partnership. This is the 15-year battery. As you can see, that remote control is pretty tiny, okay? And you don't have to take it with you. You just keep it in a safe place. That way, when you want to make changes, you can. All right, and you can see it's a very small controller. The actual battery, if you see there, you may not be able to tell. It's probably the size of $2 silver maybe, and it's pretty small, and it goes in the back, in your top part of your butt and your backside. No one knows it's there. You don't even know it's there. Okay, it's under the skin. I bury it under. Everyone has a little bit of fat back there that we buried under. Okay, patient remote control, very tiny, easy to use, pocket size. I tell people keep it in a drawer. Whenever we need to make changes, bring it with you, or you can make changes at home. Just keep it in a safe place. You don't have to take it to work or, when you go to the gym or wherever. Now, if you're going to be gone, week, 2 weeks, 3 weeks, bring it with you because you never know. You may want to make changes when you're gone. You can get MRIs with this, full body MRIs. This is a big deal. A lot of people need MRIs, and typically with what we call pacemakers, which is it's a bladder and bowel pacemaker. You can't get MRIs. If any of you have heart pacemakers, probably can't get an MRI. With this, you can. It's MRI compatible. There's an MRI mode. It's very easy. It's a game changer. So I've had to take out, before these became MRI compatible, I used to have to remove these so patients could get an MRI. You don't really have to do that anymore if they get if they get these, if you get one now. And it's been like this the last 2 or 3 years where these newer versions of the battery you can get an MRI with. Okay, almost done. I promise. 93% of patients achieve clinical significant improvements in incontinence at 2 years. Okay. Once again, these are people who have tried pills and the pills can help, but some people may not want to be on pills, but they're expensive. There's side effects. Once again, they've done, believe it or not, lots of studies regarding cost and the cost of pills over 10 years as opposed to having a one and done procedure and not taking pills. It's cheaper in the long run to do procedures. By far, that analysis has been done by Medicare and a lot of people out there. Okay, axonics therapy, 2 years after the implant, over 90% of patients were satisfied with their results. That's a pretty good number. Okay, and that's reference of the article that was published in Journal of Neurourology in 2021. Okay, once again, this was Jill, age 45, okay, and she had an implant, and it's just so fantastic to live a normal life. The implant procedure was much easier than what I had thought. Like I said, typically takes me about 30, maybe 40 minutes to do. You're zonked out. You can go to sleep. You can do twilight like you get with a colonoscopy. It doesn't matter to me, whatever you want to do, whatever the anesthesiologist wants to do. Someone drives you home and boom, you're done. Not a lot of recovery. And it starts work, start working pretty soon thereafter. I think this is our last slide. So once again, thank you everyone for your patience. This is my number, or this is our number. This is our group's number. There's 30 of us. I'm happy to see any of you. Some of you out there